Welcome back. In health news, more and more women are talking to their doctors about removing their breast implants.
Plastic.
This is really interesting.
It really is.
Yeah.
Dr. Khan is here to talk about breast implant illness. What is it? What are the symptoms? And there are so many, and this has been coming to light recently within the past maybe 5 or 10 years, but people are really paying attention now.
Yes. So this is breast implant illness is a constellation of signs and symptoms that affects almost all the organ systems of the body. We actually have a questionnaire that highlights all these organ systems, and the most common being fatigue, brain fog, the rheumatological joint problems, fibromyalgia type symptoms, including the many psychological effects, including anxiety and depression. So there is actually a questionnaire that highlights all the organ systems that are affected. So one can gauge and see and assess as to what the severity of the breast implant illness is.
So the implants are supposed to be safe, but what is it about these implants that is causing all of these symptoms, this illness?
So it's the silicon toxicity, and as highlighted by the FDA in their warnings, they are associated with lymphoma, which is a breast implant associated anaplastic large cell lymphoma. They're not meant to be in the body forever, and that truly breast implant illness exists, and that there is a cure, i.e. a relief, complete relief, quote unquote, of the many symptoms of breast implant illness when the implant plus the capsule is removed.
Geez, I mean, we were just talking to the break. You said it's instantaneous for someone.
Right. So I see my patients right in the recovery room. Their eyesight is improved, their throat clearing we talked about, the tingling numbness, their basically anxiety issues, migraines, amongst the many other organ systems that are affected that are improved. And I encourage your viewers to join the medical community. It's a safe place on social media where the women learn from each other. A good place would be my executive plastic surgeon website, where they can network and see that this is a real entity with a real set of problems and a real solution.
Will everyone get breast implant illness? And if they do, how long does it take? Is it anywhere from a day? Is it anywhere from a week? Is it months? Is it years?
So I have had patients that have had breast implant illness from just a month out from having their implants, and some ladies 20, 30 years later. We do not know. Ultimately, as mentioned before, the breast implant illness will afflict everyone because the implants are not meant to be in the body forever. They do rupture. They have a certain lifespan, and they will deteriorate and disintegrate, and this is where the gel bleed, silicon toxicity will ultimately harm the body.
So have you seen, have you seen a shift in your business, in your procedures, where instead of putting them in, you're now taking these implants out?
Yes, absolutely. Breast augmentation used to be the #1 most common procedure. Now with the many celebrities that have come forth and now the social media awareness, a lot of ladies have learned very much hands-on themselves that breast implant illness is very much real, and now there is a continuing trend of the many ladies who are explanting and only regaining their good health and their life free from the silicon toxicity.
We're obviously talking to you on New Year's Day here. Happy New Year to you.
Thank you.
Do you find that with everything going on during the holidays, from Thanksgiving all the way to New Year's here, that a lot of people that have medical issues like this, they kind of put them off for a little while? I'll deal with that later. I'll deal with that later. Do you get kind of flooded with phone calls here in the first few weeks of the new year?
Yes, you know, this is a very interesting time where people think about good health, exercise, and now what I want each and every one of your viewers to listen to is just go back and look and assess. Sometimes it's so subtle, you may think it's the stress, it's being in their 50s, I've got 3 kids. There's so many factors, the stress of the job, the stress of the holidays. So one can easily gauge by going to the questionnaire and assessing the severity of the illness, because many patients don't realize that it was indeed the breast implant illness and not their age or the other underlying medical problems that they may have.
Where do they find this questionnaire?
So they can go to the executive plastic surgeon webpage. They can join the breast implant illness private and safe open platform where the ladies can discuss at the private breast implant illness Facebook support group page, where they network and learn. And it is a involved topic, but something that is easily comprehensible, and they can learn and share with the many other ladies who have explanted successfully.
All right, so much information. Thank you. We appreciate it.
Thank you.